So just one very quick thing before we start. Remember I was talking about equipment suitability and an EN ISO or BSEN ISO cleanroom standard related to it. So go and I talked about roller doors. So if you go onto the Dynaco stand, they will show you information about and talk about the tests they had carried out on their doors in Germany at the Fraunhofer Institute to test their particle emission so that they could certify their suitability to go in clean rooms. So if you're interested in seeing an example of a practical application, go and visit them. And they haven't paid me to say that. Okay, so let's move on to Jack Stanford. Welcome, Jack. Jack works for Wickham Laboratories and is an environmental monitoring specialist, and he's going to talk to us about regulatory compliance, trends, qualification, and guidance for microbiological monitoring. So, good luck.
Thank you.
And welcome.
Good afternoon, everyone, and thank you for joining me at Cleanroom Technology. It's great to be here and stand in person and stand in front of a room with real people, but I feel like you've heard that joke multiple times today. Wickham is a contract testing laboratory with 50 years of expertise in the pharmaceutical and medical device industry, helping companies bring their products to market safely and reliably. We operate into GMP and GLP standards. We are regulated by the MHRA and FDA. In my role as environmental monitoring, I provide consultation and perform routine testing and analysis of our clients' facilities to ensure their clean rooms are operating within safe microbial limits and will prevent contamination of their products. Contamination events in pharmaceutical and medical device manufacturing can be extremely hazardous to the health of the patient using the product. There can also be significant financial risk for the manufacturer in terms of potential product recall and damage to the company's brand image. After all, nobody wants these kind of negative headlines as a result of contamination in their facility. And remember, in the digital age, these stories stay on the internet forever. To help minimize these risks, today I'll be discussing the different types of environmental monitoring that can be performed, outline the regulatory standards and clean rooms need to adhere to based on product and location, and lastly, go over the importance of data trending with ongoing monitoring to ensure facilities are always up to standard and compliant with regulatory requirements. To start with, I should probably provide an overview of what microbial environmental monitoring is, for the benefit of those who may not be familiar with the term. This is a type of monitoring that uses nutrient agar plates to identify the micro levels present in an environment, such as a laboratory. Typically, we use three ways to monitor the micro levels, namely passive, active, and surface monitoring. Passive monitoring is performed using 90mm nutrient agar plates as settle plates. These are then left exposed in an area for up to 4 hours. This type of monitoring can detect the microbial levels that may settle in a particular location. Active monitoring is performed using an active air sampler, which pulls a set volume of air, usually 1,000 litres, onto a nutrient agar plate. By doing this type of monitoring, you can identify the microbial levels present in the air at the chosen location. The third method is called surface monitoring. There are two types of methods for surface monitoring, either using swabs or contact agar plates. Swabs are generally used for uneven surfaces, such as grated shelves, whereas contact plates are used for flat surfaces, such as bench tops. Contact plates are also used for hand and glove sampling. In an environmental program, all three monitoring types will need to be used routinely to ensure that you have a clear picture of the micro levels present in your environment. There are a few reasons why an environmental program is recommended for any facility and why it is required in some instances. One reason is so that you have confidence in the micro levels in your environment are at an appropriate level based on the products you are manufacturing in a representative conditions. These types of conditions exist when the clean room is occupied and any required processes are taking place. By performing monitoring during these conditions, you'll be able to understand and assess the impact that people, equipment, or processes may have on the environment. Another reason is to show the effectiveness of cleaning procedures that are in place at the facility. Using microbial environmental monitoring, you can assess whether the disinfectants in use and the frequency of cleaning are appropriate for the facility. These types of monitoring show that the environment is under control and the micro levels are being maintained at low levels, meeting the requirements for graded and classified clean rooms which adhere to good manufacturing practice, or GMP. Data showing that an environment is under microbial control can be used as evidence that the environment itself may not be interfering with the production in a facility. This data can be used as evidence to show regulators during audits. There are a few different standards and regulations that will need to be followed, whether you're operating an already established clean room or setting up a new one. For this section, I'll be focusing on GMP clean rooms. The standards or regulations that you may need to follow are determined by the region in which your product is being sold. I've put some examples on the slide. Some of these are required to be followed, while others are used for information when setting up and to review your environmental monitoring. BSEN 17141 is a relatively new standard which is a superseded version of ISO 14698, but it's currently only recognised in the UK and Europe, whereas ISO 14698 is still recognised internationally. It's not yet been made clear whether the content will be a requirement for regulators yet. However, it does add clarity when performing microbial environmental monitoring. Some of the key points mentioned in both standards are establishing microbial control, which can be done by identifying all potential contamination sources by performing a risk assessment and establishing a monitoring plan, which includes setting alert and action levels. Demonstrating microbial control, which can be done by having effective monitoring systems in place, such as trending, evaluation of results, and the importance of out-of-specification investigations. The main difference with ISO 17141 is that it builds on the points in ISO 14698 and is therefore helpful to use as a reference, even if it is not a requirement for your clean room. I've also included the FED standard 209E. However, this has been superseded by ISO standards, but it's still sometimes referenced, and some clean rooms are classified as per this standard. For the US standard, there is a United States Pharmacopoeia 1116. This standard has details from both ISO 14698 and ISO 14644 and includes some of its own points. However, it does not contain any mandatory requirements as it is numbered above 1,000. The current EU GMP Annex 1, as well as previous standards, highlights the importance of having micro-monitoring when aseptic processes are being undertaken. There's also reference to perform formal risk assessments and set an appropriate alert and action limits. With the update to Annex 1 looming, there are a few changes when it comes to microbial control. However, as there is a separate presentation on this at this conference, I will not elaborate on this here. Lastly, there's the PDA Technical Report number 13. This report provides a nice summary of all the requirements detailed from various other standards and regulations, though it is a little bit outdated now. It's worth noting that ISO 14644 is also required to be followed in clean rooms. However, I've not included it here, as it mainly focuses on particulates in general, whereas the others are more specific to viable or microparticles. As I said earlier, when it comes to wanting to distribute a product to multiple markets, you may need to adhere to multiple standards. As a result of this, you might run into some challenges in ensuring that you have adhered to all the relevant standards and regulations. Luckily, if your product requires to adhere to multiple standards, the majority of the content between these standards and regulations have been harmonized, making it possible to adhere to multiple regimes at the same time. That said, there can still be some confusion when it comes to certain requirements. But as I mentioned previously, the PDA Technical Report number 13 is a good fallback option when trying to adhere to multiple different standards or regulations, as it summarizes the requirements found in other standards and regulations. An example of how some of this confusion comes about is the way the classification of a cleanroom is referred to. In various regulations and international terms, create several different ways in which cleanrooms are labelled. In ISO and US regulations, they're referred to as classifications or classes with different numerical labels, whereas in EU GMP, they're referred to as grade A to D. For instance, in ISO, an ISO class 8 cleanroom would be called a grade D cleanroom under EU GMP and a class 100,000 under US regulations. I've put some examples on the slide. In most cases in the UK, only grades and ISO classifications are used, so it is always best to reference both to avoid any confusion. After the appropriate standard and regulations have been decided on, a microbial monitoring plan can be set up. For both an established cleanroom looking to implement a monitoring program or a new cleanroom being commissioned, the first step is to perform a risk assessment of the cleanroom, adjacent rooms, and the procedures that will be undertaken in these areas. The risk assessment will consider a variety of factors, such as the required specification of a cleanroom based upon its grade or class, any procedures that are required and may possess potential contamination risk, equipment that is present inside the facility, mapping of material, product, and people flow throughout the facility, and airflow patterns. The aim of this is to highlight any potential contamination risks there may be to the product whilst inside the facility. Once a risk assessment has been carried out, the results can be used to create a microbial environmental monitoring plan. Using the risk assessment, appropriate sampling points positions can be decided based upon the highest risk locations. Once a plan has been created, performance qualification testing can be performed. For a new cleanroom, both an at-rest and in-use qualification may be required. The at-rest qualification is performed before any equipment has been moved into the cleanroom and prior to any processes being implemented. The aim of the at-rest qualification is to show that the cleanroom itself has no underlying microbial issues present. An example of an underlying issue that I've seen in the past is that a HEPA filter wasn't working correctly, which resulted in a really high bioburden, and we had to repeat the entirety of the work, what was a 3-day adventure. Once the at-rest qualification has been performed and has passed according to the required specification, the in-house qualification can be undertaken. Sampling positions will need to be reviewed for the in-house qualification, as adding equipment may have interfered with the original placement used at the at-rest qualification. This is performed once the equipment has been moved into the cleanroom and cleaning procedures have started. The aim of the in-use qualification is to show that the equipment and procedures taking place are not causing any microbial contamination. The in-use qualification is also able to demonstrate whether the cleaning procedures are correctly lowering the microbiome burden in the cleanroom. For an already established cleanroom, you can choose to perform an in-use qualification only, as removing existing equipment isn't always a feasible option. To determine whether your cleanroom has passed the qualification stage, you can compare the results to the recommended levels stated in the relevant regulation or standard you are following. Both GMP Annex 1 and BSEN 17141 give easy to understand recommended levels. Before initiating any microbial monitoring plan, the baseline level should have already been decided. There are two commonly used terms, namely alert and action levels. An alert level is used as a warning if microbial levels in an area have increased above the usual trend, whereas an action level is the maximum level of microorganisms that can be present in the facility based upon your classification. An action level would not usually change. However, the alert level should be reviewed periodically to ensure that it is in line with the ongoing microbial trend. A standard time frame to perform this review would be annually. The alert level is usually based on the recommended levels given in the regulations and standard, as well as the average trend seen in the facility. When starting a new monitoring program, there will not be sufficient data to give a tailored alert level for your facility. So it will take around a year to gather the necessary data to set an appropriate level. This could also apply to the action level if you deem it necessary to reduce or align this to the current environmental trends seen in your facility. The method used to decide the alert and action levels will need to be justified, as this will be reviewed by regulators during audits. One example of a robust method is used to calculate the alert and action levels is using the standard deviation and the average of the results seen in a facility. By using this, you can calculate an appropriate alert level by having the average plus 2 standard deviations. But it is important to note that this may not be appropriate for some facilities, and the way the alert and action levels should be calculated should be tailored to your own facility. It's also important to understand that the alert and action levels are not specifications. This means that these results should not be used when deciding whether a product has passed or failed, and should only be used as indicators of the level and the types of microflora present in a facility at the time of monitoring. Once the performance qualification stage is complete, a routine monitoring plan can be established based on the microbial environmental monitoring plan created during the qualification stage. The frequency of the routine monitoring should be based on how high the risk is to the product if microbial contamination occurred. For sterile products, environmental monitoring should be continuous throughout the fill and whenever the product is exposed. This is set at regulatory guidance. For monitoring other processes or areas in a facility, the frequency should be determined based on the contamination risk present in those particular processes, as well as the need to provide sufficient and frequent data in order to establish meaningful trends from the environmental monitoring results. Based on this, as well as the initial risk assessment of the cleanroom, a monitoring frequency can be determined. In a few of the standards, there is guidance on a recommended frequency. However, Annex B of BSEN 17141 provides additional guidance on this topic. For sterile products that can be thermally sterilized, microbial monitoring can be at a low frequency, either monthly, quarterly, or twice a year. For sterile products that cannot be thermally sterilized, monitoring should be performed at a high frequency, either per shift or daily, depending on the production activity. For non-sterile products, monitoring should be performed in regular intervals, such as on a monthly basis. It's worth noting that sampling too frequently can cause further contamination issues with the product due to disturbance by the sampling personnel. Therefore, a balance needs to be maintained to ensure that sufficient sampling is being performed without introducing potential contamination to the product. Regular microbial monitoring will show you that the microcount results are within the required alert and action levels for each session. However, you can do more with this data. It is recommended that identification to species level is performed on organisms that are isolated. The reason why is to enable you to identify any objectionable microorganisms present in your environment that may pose a risk to your product. These microorganisms would ultimately cause harm to patients who use the products. An example would be for inhalation products where isolating Burkholderia cepacia in your environment should be of concern. Using both the general count and any identifications performed, a trending system, such as a spreadsheet, should be implemented. This is to make sure that you can log all your monitoring data you have produced and highlight potential issues with your environment so that corrective actions can be implemented before they cause any breaches to the alert and action levels. Trending data of the microorganisms that have been isolated in your facility will help clarify any outer specification results occurring with your products. Looking at different types of microorganisms that were isolated during a particular occurrence, it is possible to determine if these are related. In turn, this data can provide possible origin of contamination. Another reason for logging all your monitoring data in a trending system is that it's a good tool to use during regulatory and customer audits. This data will show to your regulators that you are in control of the microbiome burden of your clean room. Also, if you have any breaches in the alert and action levels, you can show regulators what corrective actions you have put in place to prevent reoccurrences. Regular recoveries of the same organism could indicate the possibility of having resistant strain in your environment, and this may mean that cleaning procedures need review and adjustment as current disinfectants aren't working correctly. Trending data into a table is the easiest way to input the relevant information, as seen on this slide. I've put some examples data from environmental monitoring performed using settle plates. However, just by looking at the data in a table, it's not easy to distinguish the trend occurring. Once the data has been plotted into a graph, as seen here, it's much easier to visualize that an increase in bioburden is occurring in the sampling position. In this example, as the monitoring goes on, there's a trend of an increased microbiome burden seen. By having this type of data evaluation in place in your facility, you can see by week 24, a trend is occurring, meaning that you can perform necessary corrective and preventative actions before a breach to the alert and action level occurs. I would like to conclude by reiterating the key points I've made during this presentation. Prior to creating a microbial environmental monitoring program, it's necessary to have performed an accurate risk assessment. This assessment should review the facility, including any equipment, process flows, and airflow patterns, to be able to highlight any potential contamination risks that may cause concern to the product. Once a risk assessment has been performed, a performance qualification of the facility should be performed to show that it's suitable for use and that the microbial levels are in control. The performance qualification may have two parts, the first being at rest, which will give a baseline as to whether the facility has been constructed correctly prior to moving in equipment and initiating processes, and the second being in operation, which is where monitoring is performed whilst equipment, operators, and processes are in use. Based upon the initial risk assessment, as well as the performance qualification, a routine monitoring plan can be created and implemented. The data produced from the monitoring plan can then be inputted into a trending system, which will aid in identifying any potential alert or action breaches before they occur. Thank you very much for taking your time to come and watch my presentation today. I think we have some time for some questions.
Okay, thank you, Jack. So thank you for reviewing the practices and approach. Questions, first of all. I don't think there are any online at the moment. Let me just double check that. No, not at the moment. From the audience. Can I see anyone got any questions for Jack? Must be some questions for him.
I have a question.
Yes.
So Jack, you were talking a lot about just the production environment itself and at rest in operations testing. What are your thoughts around gowning room, material transfer rooms, so the supporting infrastructure and validating those areas?
Okay, so the question is, you focused on production areas principally. What's your view about the importance of support areas such as gowning rooms, airlocks, corridors, and so on? I think that's the essence of your question. Thank you.
I do think it's really important to make sure you monitor adjacent rooms as well. Obviously, the alerts and limits and that sort of level should be a little bit higher because it's mainly for information only. But it's a good indication, so you could have breaches happening in your change area before it occurs in your clean room, so you can capture an issue before it actually becomes an issue. So, yeah.
And like construction or initial validation, would you validate to an ISO standard or a grade gowning room?
So you can just use it as a reference because where it's not actually a graded room, it's not technically a requirement, but it's something you should do as well, just to have the information there. And it's good to show regulators as well that.
Okay, yes, gentleman there.
So you mentioned the identification of objectionable organisms, for example, in inhalation products. How would you set an objectionable organism inhaled product compared to like a sterile injectable product, and how would you deal with them differently in a grade C to a grade B, for example?
Okay, so this is about objectionable organisms in inhalation product manufacturing. Would it be different if it was an injectable product?
Well, if it's injectable, you don't want any growth at all in it anyway, so you would want to ID that immediately, just to find out what it is, because you can tell them by the species, you can find out where it's come from. So if it's from skin, so you know whether you've got an issue from a person has caused contamination, or from soil, so it's come in through any sort of equipment. So yeah, I would say it's also as important. I think it would be accordance to your limits, so based upon what you're actually manufacturing or testing in your lab. Cool.
Okay. Anyone else? No? Yes, okay.
So I work a lot with manufacturers of gene and cell therapies. So obviously, as you know, they are living medicines, and you can't sterilize them on end, like, for example, use small molecule drugs, like aspirin.
Yeah.
So they have to be manufactured in this really controlled environment, like ISO class 5. So when it comes to those monitoring strategies, I assume they have to be really much stronger and tough in that kind of manufacturing settings when you manufacture those living medicines, right? So how does differ in how much stronger this have to be, and how this differ to to setting that strategy, for example, in the manufacturing of small molecular drug?
Yeah, so obviously it would need to be a lot more robust, and it's dependent on, so performing a risk assessment, you can find the critical areas of where contamination can actually come from. So it's ensuring that those critical areas are all being monitored, and as well as having just some normal passive monitoring ongoing during any point that the product is actually exposed. Yeah. And yeah, basically, it's more on like a basis of risk to find out those critical points and then make sure those are monitored.
So you do have to perform like a risk assessment to identify
Yeah.
those critical points.
Before doing any sort of monitoring, I would strongly recommend doing a risk assessment. Just have like an outside person or even someone from your facility, but it doesn't work in that lab, come in and have an objectionable opinion of the room. So they're looking for the specific areas that are the highest risk.
Okay, thank you. We have Jessica Mason online who's asking a question. Would you ever consider increasing the alert level at review? Question. We also use standard deviation, but with a lot of zeros year on year, we reduce the alert level almost every year. But does that really help us find trends or alert us before we really have an issue?
It's very similar with us as well, because how we do our monitoring at our lab, and we just get zeros. I think we've had zeros in some of our positions for the past 4 years. We've just justified by just keeping our alert level at the same level, and we've not actually dropped it lower. We've kept our action level as it is. And it's not always worth it to keep dropping it. I know it's to follow on your trend, but if you're constantly showing zero, you might have a spike at some point, and you don't want, yeah. That makes sense.
So you're more worried about frequency of occurrence?
Yeah, so it's like the frequency, and as well, the microflora can change year by year as well. So obviously in the winter, you'll have a lot lower limits.
So Jessica, I hope that answers it. Avoid losing sensitivity. Okay, anyone else? Okay, thank you very much.
Thank you.